spread of the Omicron variant of concern. Before we begin, I just want to remind everyone that we will be taking questions here today through the QA function. We're joined by representatives from the Ministry of Health as well as the Chief Medical Officer of the Health's Office to walk through a presentation with you. If you do have a question, please put it in the QA box. We'll take it throughout the presentation and we'll be monitoring on the back end. And in the time allotted, we'll try to get to as many questions as we possibly can. With that, Minister MacLeod, I'll turn it over to you for some opening remarks.
Thanks very much, Derek, and thanks everyone for joining us. I believe this is actually one of our largest yet with 1,700 folks registered. So I do appreciate all of you taking your time today to walk through with our public health officials as well as my officials from the Ministry of Heritage, Sport, Tourism and Culture Industries what the new easing of restrictions means for you. And I mean, I'm very impressed with the breadth of which we've got folks on the line today. We've got everyone from the Balmoral Motel at Barry's Bay to the National Ballet, to the Bruce County Museum, to Boating, Ontario, and from the city of Greater Sudbury to the Ontario Science Centre. These sectors, you don't need me to tell you, have been hit first, hardest, and will take the longest to recover. And you are absolutely critical to the social and economic survival and viability of the province and your communities in which each of you reside, which is why it's been important every step of the way for this ministry to continue to communicate to all of our industry and sectoral partners to ensure that you have the best information in a timely manner in order to make decisions for your business or your organization. Today's briefing obviously will focus on the public health measures and the easing of restrictions as were announced today by the Premier of Ontario and the Chief Medical Officer of Health, as well as the Deputy Premier of Ontario and Health Minister. We will continue to work with our colleagues across the different ministries in order to best support our sectors. Today I am joined by the Associate Chief Medical Officer of Health, Dr. Murty, who is going to walk you through a deck, along with Chris Harold, who is the Integrated Strategy and Policy Director for the Ministry of Health. In addition, for any sector-specific questions that you may have, we have on the line my Deputy Minister, Sarah Harrison, as well as our ADMs. Of course, everyone knows that Tyler Curry has been with us for a long time, and our new ADM, Catherine Kelly Grattan. So very excited to be able today to talk about some of the easing of restrictions, though I do recognize there will be some additional questions that you may have with respect to your specific sectors. I know a few of you have already contacted me about what does this mean for local sports, dance, what does it mean for cinemas, and what does it mean for larger venues. I know this is a lot of optimism today, but it's also, I guess, there's still remaining questions. So we're happy to take any questions. As always, please consider contacting us at minister.macleod@ontario.ca. If we can't get to your question, minister.macleod@ontario.ca, and it's MAC. You can always use in the Q&A, and I see there's 46, 48 now in there already. Use the chat box. We'll get to you as quickly as we possibly can. And we're going to make sure that if we don't have a response for you today, that we will get one. Keeping in mind that the announcement today, as it pertains to the 31st of January, the regulations are still being worked on. And so my team will continue to work with the Ministry of Health in bringing our stakeholders' perspective to this conversation as well. So with that, I want to say thanks for everybody for joining us. And I would like now to turn it over to the Ministry of Health and Dr. Murty, the Associate Chief Medical Officer of Health at Public Health Ontario, to walk us through a deck. And but before I do that, I do have a special guest, a colleague of mine, Minister Khalid Rashid, the minister responsible for digital governance. And I know that we've had a couple of questions from the Tourism Industry Association of Ontario, as well as MLSE and a few other stakeholders who are bringing in people from different parts of the world, namely the United States, and have had to turn people away as a result of the QR code. So I invited Minister Rashid to join us today to talk a little bit about the QR code. And if you have any additional questions on that, he'd be happy to respond to those as well. So Minister Rashid, if I may now turn it over to you to address the group. We have about 1,700 people registered here today, and they come from every part of Ontario, and they come from all of the various heritage, sport, tourism, and culture industry sectors that I represent. So Minister Rashid, over to you.
Thank you so much, Minister MacLeod. Really appreciate, and a good afternoon to everyone. Thank you so much for having me as part of this conversation. Minister MacLeod yesterday asked me to join to provide some update as to where we are with our Verify Ontario app, but also QR code. And I'm glad that I'm joined by my team of Ministry of Digital Government, and my colleague Spencer is here as well to provide some information. Oh, there we go. There's Spencer right there. He is the brain behind the app and all the great work that the ministry has been doing in making sure that we are here to support the industry, our stakeholders. And I'm very happy to take any questions that you may have. We continue to bring a lot of jurisdictions on board. One thing I can share here is that all provinces across our beautiful country, Canada, as well as territories, can now use their official QR code and can be verified by our Verify Ontario app. So that is a great news. And again, we are here to answer any of your questions, my team and I. So over to you, Minister MacLeod. Thank you.
Okay, thanks very much, Minister Rashid. I know that there's lots of questions in the chat box. Hopefully, Dr. Murdy will be able to answer a number of them. And we'll hand it over to you now, Dr. Murdy, and thank you very much for joining us today.
Thanks so much, Minister, and thanks for inviting us today. I think obviously a big announcement day, and we're happy to walk you through some of the details of the plan of the reopening, as well as answer lots of questions we're seeing in the map in the question and answer. So thanks very much for your opportunity, and we will take you through. Next slide. All right, so as follow-up to the announcement today, this deck that we're presenting is a general overview of how the government intends to exit its modified step 2 of the roadmap to reopen, starting as early as January 31st in the absence of any concerning trends in public health and health system indicators. While some public health and workplace safety measures are highlighted, this is not a specific and exhaustive list. Further details in the regulations are still forthcoming. Details regarding the exact public health and workplace safety measures that will be part of reopening will be shared as the regulation is amended and approved by government. So just to kind of recap where we are currently in response to the rapidly highly transmissible Omicron variant, the province moved into a modified step 2 as of January 5th. Within the measures within January 5th, it was intended that they would be in place for at least 21 days, subject to other trends in public health and health indicators. Given the announcements yesterday by the province in terms of some early signals of stabilization of the healthcare sector, government is now releasing its approach to exiting modified step 2, which includes a gradual and incremental reopening in general alignment with the plan to safely reopen Ontario and manage COVID for the long term. This is meant to be a gradual and incremental approach to help continue to protect people in the province as we lift public health measures and to ensure that we're not at risk for resurgence and having to re-implement measures. Next slide. So just to highlight for you the objectives of exiting the modified step 2 of the roadmap to reopen. First priority was to have return to in-person learning, which started this week. Preventing mortality and morbidity associated with COVID-19, protecting our health system capacity, being able to reopen businesses that are currently closed and mitigating against any future closures, as well as protecting our health system and our ability to vaccinate individuals. As we look to the lifting of the measures, gradually and implementally, these will be guided by an overall risk assessment. There's not one single metric that we're looking at in terms of when we would be ready to reopen. This is an overall assessment based on public health and clinical judgment on the metrics that we're seeing. Some of the metrics that we're looking for are a decline in percent positivity, so that testing positivity, looking at a decline in the number of outbreaks in highest risk settings, such as long-term care homes and hospitals, as well as a plateauing or decreasing of new hospital and ICU admissions related to COVID-19. As well, multiple interventions would still need to continue to accompany public health measures as we continue with reopening. Next slide. So while we are looking to allow further public health measures, there are some foundational measures that are still needed to continue to support the reopening. We still need people to stay at home when they're sick, as well as to self-isolate if there are contacts of cases. We still need to have excellent rollout of vaccinating, particularly our third doses, and with 4 doses where applicable. Still requiring proof of vaccination in select settings. Ensure that people are still adhering to wearing a well-fitted mask when they're in public or outside their homes. Maintaining 2 meters physical distancing in spaces. And then the other infection control measures that have now become part of our regular life in terms of hand hygiene, practicing respiratory etiquette, cleaning, disinfecting high-touch surfaces, and attention to ventilation. Next slide. All right, so now for the details of the measures and the 2 phases or 3 phases looking at as we progress and coming out of step 2. So subject to other risk assessment, including key indicators remaining stable and improving, the following public health and workplace safety measures will come into effect. So the first tranche is no earlier than January 31st of 2022, and that would be a reopening to 50% capacity for most indoor public settings. So that would now include indoor dining in restaurants, gyms, casinos, cinemas, and other places where there is proof of vaccination required in select settings. There would be a 50% capacity or 500-person cap, whichever is less, for spectator capacity. And that would apply to facilities used for sports and recreational fitness activities, including sporting events, concert venues, and theaters. There would also be a lifting in terms of the restriction of hours of operation for restaurants, bars, and other food and drink establishments. There would be an increase in the social gathering limits, which are currently at 5 indoors and 10 outdoors, to 10 indoors and 25 outdoors. That would be a 50% capacity for indoor religious services, rites, and ceremonies, as well as other protective measures that would be in place. For example, there would be the continuance of not allowing a sale of food and beverage for places like cinemas and indoor arenas. The second tranche of reopening would happen within at least a 21-day interval from the first round, which would take us to no earlier than February 21st or Family Day. At that point, we'd be looking at 100% capacity for indoor public settings, where there's proof of vaccination is required. Capacity in other indoor public settings is the number of people that can maintain 2 meters physical distancing, so based on the size of the facility. 50% spectator capacity in areas of facilities used for sports and recreational fitness activities, concert venues, and theaters. 25% capacity for higher risk settings, such as food or drink establishments with dance facilities, as well as bathhouses and sex clubs. There would be an increase in the social gathering limits to 25 indoors and 100 outdoors. And indoor religious services, rites, ceremonies would be limited to the number that can maintain 2 meters physical distancing, as well as other additional protective measures. And then finally, with a 21-day interval, so no earlier than March 14th after this second round of opening, there would be a move to 100% capacity for indoor public settings where proof of vaccination continues. Social gathering limits would be limited to 50 indoors and no limit for outdoors. No limits on religious services, and other additional protective measures continuing. So thanks very much, and we're happy to take the questions.
Thank you very much, Dr. Murty, for walking us through that. We greatly appreciate it. Before we go to questions, I just want to remind everyone that the QA box is below. If you do have a question, we'll be continuing to go through those as we have time permitted here today, as well as a reminder that we do also have representatives from Minister Rashid's office joining us here today if you have any specific questions related to the proof vaccination QR code program as well. So with that, I'm going to get into some of the questions that have been presented to us here today, Dr. Murty. I'm going to start at a high level because there's a lot of questions here, and I know they're somewhat a little different depending on the nature of their operations. But first, as it relates to the 2 meters of physical distancing, it was addressed as a supported activity in your presentation there, but is it required for any activities of the restrictions that are going to be relaxed beginning on the 31st?
Yeah, so there would still be expectation that that's sort of a foundational public health measure that would be still in place in different settings. So even a facility that would be, for example, 50% capacity, like an arena, would be the capacity limit would be 50% of its total capacity. But in places like change rooms, we would still be expecting that there would be limiting of numbers to make sure that that 2 meters of physical distancing was still being adhered to.
Thank you. And along the same lines, the similar questions as it relates to masking.
Yes, so there's no changes in the indoor masking requirements. So we are still expecting people to continue to follow public health advice on where masking is continued to be required.
Okay, perfect. And again, going to continue on the same vein and talk about the proof of vaccination policy. We have a question here of, do we have a sense of when we could be reducing the proof of vaccination to include ages 5 to 11, given that they can now be vaccinated?
Yeah, thanks for that. There's no current plan to have the 5 to 11-year-olds included in the proof of vaccination policy. They have just only started to begin getting vaccinated. So I think we're just over 50% first dose for 5 to 11s, and they are recommended to have at least an 8-week interval between their first dose and second dose. So given that time frame, we're not looking at inclusion anytime soon.
Perfect. Thank you very much. Okay, we'll shift gears here and get into some of the meat and potatoes that's been submitted. I'm going to start with the sports sector, and I will also note that we have our Assistant Deputy Minister Tyler Curry on the line here today, who could also potentially assist if detailed questions.
You know what? Why don't we bring on Catherine and Tyler, just because there might be some specific questions for their sectors. Thanks, Tyler.
Thanks, Tyler, and thanks, Catherine, for joining us from our ministry. First question is with regards to youth sports, and the question is, can youth sports resume, and does that also include contact sports such as team sports, including basketball and hockey? And maybe I'll throw that. Yeah, Tyler, maybe if you want to kick off, and Dr. Murty, if there's anything you want to feed into.
Sure, yeah, that would be allowed under the changes for January 31st. I should note that what was announced today is largely the policy intent and the direction that this is going in the coming days. The regulations that will get into some of the nitty gritty that you referred to will be worked out. So we might not have answers to all of this, but I think our health colleagues may be able to speak pretty well to what the intent is in that regard.
So Victoria gets to go back to play hockey then, Tyler, because that's what she's been asking.
I think that's a yes there. Okay. And I know at least beginning January 31st, I believe there's a 500 cap in sporting venues, but Tyler, could you confirm, and then also if that means that we're able to continue with tournaments?
Yeah, so it's a capacity restriction for spectators of 500 or 50%, whatever is less. So in some cases, that number could be below 500.
Okay, perfect. Thank you very much. I'm going to shift gears here for a question.
I could maybe just clarify that last piece. Because I think just to clarify, I think the total capacity limit versus the spectator limit. So an arena tournament, like a tournament could continue at 50% capacity of the arena space for hockey, for example, but the spectator would not be part of that inclusion. So participants would be counted separately. And Chris, if you wanted to jump in to help make that a little bit clearer.
Yep, nope, that's correct, Michelle. So there'd be the rules for the spectator area would be separate from the rules for where the other parts of the facility. So it would be 50% or 500 for the spectator area, and then the facility would be the 50%.
Perfect. Thank you very much. I'm going to shift gears to both the tourism and culture angle here, but also related as it speaks, looking for commentary on food and beverage, specifically in these large-scale venues, including sports venues, but also for cinemas in particular. Are food and beverage permitted?
So in the first reopening phase of January 31st, that they would, concession is not included, that there would not be permitted sale of food and beverage within those settings. And that's the intent is really to make sure that people who are there are keeping their masks on the entire time, so that we're not having instances of people congregating or being there for prolonged periods without their mask on, that would be allowed again after the second tranche of opening no earlier than February 21st.
Okay, thank you. Personal care services, including saunas and steam rooms, where do they stand in the reopening plan?
So they're currently permitted to be open right now at 50% capacity, so that would remain the same. And I would say it would be the intent that saunas and such would reopen on the 31st.
Okay, thank you. There's also questions here around the hours of operations in the restaurant sector. As you'll recall, I believe last call was brought down earlier than would normally be the case. And so the question is, are there any changes to the hours of operations for restaurants and bars, last call and closing time?
Sure. It is intended that the current restrictions on hours of operation for restaurants and also related to the sale and service of liquor will be lifted as of the 31st. That's the intent.
Thank you very much, Chris. Tyler, I'm going to throw this one back to you because I know there's a lot of questions here from some dance studios and they're looking to understand if they're allowed to open and sell lessons.
Yeah, I'll throw that over to our health colleagues here. I believe they're indoor recreational facilities.
That's correct, Tyler. So they'd be subject to the 50%. Yep.
Okay, thank you very much. So on the similar lines of dancing, but actually as it's available in event spaces and wedding venues and for receptions, is dancing allowed in these facilities?
So it's intended that dancing won't be permitted until sort of the February 21st period. So it is intended that dancing, patron dancing will be prohibited until that time.
Okay, thank you very much. I'm going to shift gears to the tourism sector here again for a moment as it relates to accommodations, because we didn't see a lot of this captured in some of the information provided. Are there any restrictions or are accommodations permitted for cottages and Airbnbs and others across the province?
Sure. So it's intended that the current sort of restriction that is in modified step 2 will be lifted as of the 31st.
Okay, thank you very much. I'm going to shift back to the sports sector here for a moment. Sorry, I just lost sorry, I lied. I'm going to go back to tourism for a moment. What does today's announcement mean for tour services and operators across the province? Perhaps Catherine and with support from maybe Dr. Murdy or Chris?
Yeah, I was going to turn this over to our colleagues at Ministry of Health to see if they have any insight.
So I think it's intended that we would return to sort of the rules that were in place towards mid to end December. And so the indoor tours would be permitted, but there would be subject to restrictions.
Okay, thank you. And I just found the question I was going to read with regards to the sports sector. Dr. Murty and Chris asking if there's clarity here on whether outdoor sporting events are allowed to proceed and what the current restrictions are under these measures and as it progresses through from January 31st on.
Sure, Chris, do you want to walk through those?
Sure. And so right now there are there's sort of some capacity restrictions as it relates to spectators, as it relates to outdoors. So those will sort of be lifted in the 31st period and will return to sort of what was observed back in December. And again, that's specific to outdoor and the outdoor sort of fitness facilities.
Okay, thank you very much. I'm going to shift gears here for a second, and actually, Minister Rashid, this is a question related to the QR code, and perhaps if any of your colleagues on the line want to speak to this as well. The question is, can people with medical exemptions finally submit their paperwork on ontario.ca and get their QR code? And what the next steps for the Buried by Ontario app would be as it relates to those exemptions?
So thank you for the question, and I'll let Spencer Daniel address this as well too, but I'll quickly just mention that now with medical exemptions, what you have to do is that individuals just have to go to their individual doctors and submit the exemption certificate to their public health unit, who will then register their exemption on our back-end system, just like how they have been registering your vaccines, your dose number 1, 2, or your booster dose. I'll take a pause here, but Spencer, if there's anything you want to add, please.
You did a great job, Minister, and thank you. I would just say that I don't believe that's been promised on ontario.ca, and there might be some confusion around where proof is submitted at the public health unit level. My understanding is that in some cases it can be submitted electronically, in other cases it has to be done in person, but I think that's a question that's best answered by the Ministry of Health.
Thank you. Did any of our health colleagues wanted to chime in on that one? Otherwise, I have one other question related to the QR code here.
I think we would need to take that one back to our colleagues, Derek, and get back to you, but we'll note that.
No problem. Thank you. I think this question will probably go back to Spencer again before you run off. Question as it relates to QR codes for international students, specifically those who may have been vaccinated out of country, and how they could get access to make sure that their verification is applied here in Ontario.
QR codes are available for anyone who's been vaccinated in Ontario. And again, that would be largely through the Ministry of Health, but we do support QR codes that have been created and generated here in Ontario for international students. And in the cases where students might be coming from other provinces that use the same smart health card format, or other common trust jurisdictions in the states, such as New York State or California or Colorado, in all those cases, we do support them as well. We have a full list of those jurisdictions on ontario.ca, and I'm happy to provide the link in the chat.
Thank you very much. And Chris, did you want to add anything further to that?
I think that's another one where we'll need to follow up with other colleagues in the Ministry of Health here.
Perfect. Thank you very much.
Note that, Derek.
Thank you, Chris. Dr. Murty, I think this next question is for you, and it's again high level here. Just asking as it relates for those who are working from home at the moment, if that is still a requirement or just a recommendation going forward.
Yeah, so that's still currently a requirement, but that would move to being a recommendation as of January 31st.
Okay, thank you very much. Shifting gears again back to the tourism sector, we have quite a few museums and galleries here who didn't see themselves mentioned in the materials that were released. And so the question is, when will they be allowed to be open? And is the proof of vaccination still required in these settings?
Sorry, so so museums, like other indoor public spaces, would return to 50%. But they are not on the list of where proof of vaccination is required on the 31st. They used to be part of the opt-in program, and the opt-in sort of will likely come back, but more in sort of in the second tranche. But again, there's nothing from those organizations from putting in those policies themselves.
Okay, thank you very much. Again, another high-level question. Are children 17 and under required to show proof of vaccination in any of these stages from January 31st into the March date?
I can address this question. Children over the age of 12 do have to show their proof of vaccine.
Thank you very much, Minister Rashid. I'm going to shift gears here, going back to fitness activities. We have quite a few fitness centers and gyms on the line here, looking to understand if they're allowed to open and how they continue to track through the reopening plan.
Sure. So they would be part of the 50% capacity reopening as of the January 31st, and then moving to the 100% as of the February 21st. as an indoor facility.
Great, thank you very much. So I think we've got time here for a couple of other questions. Let me just see. We've answered quite a few on the topics here as well. So there is a question quite technical and unsure, Chris or Dr. Murty, if we can talk about this as relates to the regulations, understanding when they may be available and whether or not it's going to be based on the existing regulations or moving back to step 3.
Sure, I'll take that. So right now, I would say this is all intent. We have initiated work on the regulation. We anticipate that it will be available next week. And right now, we anticipate that it'll be, we'll return to OREG 364. But again, that's intent. And I think we will work with our colleagues in Ministry of Heritage, Sport, Tourism, Culture, Industries to share that with you as soon as it's available.
Thank you very much. Dr. Murty, there's another question here for some of those large-scale congregate settings, better understanding the reason for the change from 1,000 permitted in a facility down to the 500 cap.
Yeah, I think this was, shift and change to, again, help manage the overall total numbers in some of these venues and settings. We do recognize that, other parameters are in place, but desire for government to have still, a lower number of individuals that would be congregating the spaces for that purpose at this time, and that they would be increased as of the second tranche of opening.
Thank you very much. So I've got time for one last question here before we go to closing remarks with the ministers. Actually relates to restaurants. As we know, there's been some restrictions on buffet services. Wondering if that changes with any of the announcements made here today, or when they'll be able to resume activities from sharing plates and such.
We can take that one back. I think, again, the intent in the first sort of tranche is that patrons in sort of restaurants and bars will need to remain seated, which makes it difficult for buffets to sort of operate in that environment. So it'll likely be in sort of the second tranche on the 21st.
Great, thank you very much, Chris. So once again, I want to thank everyone for submitting their questions here. We've got over 300 questions, so we tried our best to answer as many as possible based on the broad themes that have come in here. We do encourage you, if you do have specific questions, we're always available to support at minister.macleod.ontario.ca if you have further questions. But before we depart, I'll turn it back to Minister MacLeod for any closing remarks.
Thanks very much, Derek. I want to say thank you to Dr. Murty and to Chris Harold for answering the questions. Of course, to my superstar ADMs, Tyler, you're doing a great job and bring a lot of comfort. And of course, I want to thank Catherine and welcome her to the team. Before I do my closing remarks, I would like to say thank you to my colleague, the Honourable Khalid Rashid, the Minister responsible for digital government, and obviously for the QR codes, and offer him an ability to have some closing remarks about the work that his team is doing with the Ministry of Health and in order to support the sectors that we represent. Minister Rashid, over to you.
Thank you so much, Minister MacLeod. To everyone who have joined, we will continue to work with our partners around the world as soon as each jurisdictions, whether even in states right now, we have in US, we have about close to 12 states who are part of the smart health card system. So we are able to register their QR codes into our system. So as soon as other jurisdictions get registered with the smart health card system, our app here, Verify Ontario app, will be able to read their QR codes, and we will continue to work to make sure that our tourism sector and especially the sector which is present here, we are here to support you. So please, if you have any questions in regards to the app or the QR code, please feel free to reach out to me or my team. We are here to support you. Thank you, Minister. Over to you.
Thanks very much, Minister Rashid, and thanks everybody for taking the time. I really do love these forums because I think, first of all, we're able to get information out to you, but the questions that you ask actually help inform the ministry, but also assist with the public medical officer of health and the Ministry of Health in considering some of the things that we're up against. So just on this, obviously today was good news for museums, for galleries, for our science centers, for our gyms, for our restaurants, for our cinemas. I know it's the larger event spaces that we're concerned with, and so if we do have or you do have any further questions, please make sure to contact me at minister.macleod@ontario.ca. As Tyler mentioned, our ministry will be working with the Ministry of Health as well as the Chief Medical Officer of Health's office on the regulations over the next week. And provide our perspective and the best practices from our sectors. So I really encourage all of you, if you do have further questions, to get them to us as we set those regulations forward and we work as a government to best address them. Again, I know that there's about 341 questions in the Q&A box. We will endeavor to get back to them. I know many of them are similar concerns. So if we didn't address them during this approach, we will make sure to get back to you as soon as we possibly can. Just on two final other points as we begin the gradual reopening of the province with the dates outlined by the Premier and the Chief Medical Officer of Health. We will be in the next little bit announcing the recipients of the Ontario Tourism Recovery Program. That was a $100 million program, and we want to make sure that we're supporting those private for-profit companies that have been affected by the various shutdowns and restrictions. To get that liquidity into your hands and your pockets. And of course, we're making sure that we raise our concerns. And at 2 o'clock, I have a meeting with my federal, provincial, and territorial colleagues as it pertains to tourism and hospitality. And tomorrow with my federal, provincial, territorial colleagues as it pertains to sport and recreation. So I'll make sure to bring those federal concerns to the appropriate folks tomorrow and today. And then just finally, with the good news today that we are moving toward reopening for many people in the province of Ontario, I encourage you as well to take advantage of the staycation tax credit. If you're planning a hockey or basketball tournament, or you're taking your gymnastics or your dance group anywhere in the province, you will qualify. It is a $270 million incentive. We will be meeting with stakeholders early next month to talk about how we can best get that message out around the province to get people talking about it and getting people to reconnect and rediscover this magnificent province. So look, everyone, again, I just want to say thank you to my colleague, the Honourable Khalid Rashid, Dr. Michelle Murty, and of course, Chris Harold, in joining our team at the Ministry of Heritage, Sport, Tourism, and Culture Industries in order for us to best and most transparently support you and your efforts in every part of this province, in all of the sectors that we represent. And I'm going to sign off by saying what I've said to you on many, many, many occasions. We're responsible for a significant, spectacular double bottom line. Each and every single one of you are in your communities doing what you do best, which is making sure that people in Ontario love to live where they do, and why people from around the world want to visit this wonderful province. So keep doing what you're doing. You are critical and you are key to the economic and social recovery of the province of Ontario, and I think we got one step closer to that today. So thanks, everyone. We'll look forward to another update as soon as we get the regulations up and running, and look forward to getting some more money rolled out the door to support our critical sectors in the province of Ontario. So thank you. And I wish you well. I hope you stay safe, and I look forward to communicating with all of you in the days ahead. Thank you.
Thank you, everyone.